everybody! You have tuned in to Rachel's Roundtable. I'm your host, Rachel Stovall, your favorite community advocate. And as usual, I'm advocating for the health and well-being of this community. Man, we've got a good show today. Do you see me? I'm just aglow with excitement. So let's go in, meet our special guest, Dr. John Dygert from Advanced Primary Care, Pinnacle Advanced Primary Care. Wait till you find out what is going on with this and how you can use it in your life. All right, y'all, we going in.
All right. Well, thank you very much for having me. It's great to be here.
I'm so delighted to have you.
Yeah, Pinnacle is a great project that we started. Gosh, it's been almost a year ago is when we did our soft opening. Mm-hmm. It'll be a year ago next month. And when we opened, my co-owner and business partner, Dr. April Lynch, was on jury duty for a week. Like, it just happened to be the exact same week we opened. Yep. And
everything gets in the way when you're doing that new thing, doesn't it?
Exactly. She couldn't. She tried to get out of it, but she couldn't. Not very hard. And then we just started with a handful of patients, but we've been growing ever since. So pretty exciting.
So lovely. Sherry Brown is with us. Why don't you tell our audience what she does too? Because we have folks tuned in by Facebook Live and also by Citrus, and we just want to find out everything that's going on.
Absolutely. Sherry Brown is an absolute superstar. She is our Director of Patient Engagement. Okay. So she's really valuable to us from the clinical side of things. But she is also a big advocate for our clinic out in the community and getting our name out there and letting people know what we're all about. When it comes to member engagement or patient engagement, it's all about making sure that we have a partnership with our patients, because most of the decisions that you're going to make that affect your health are not made by me, right? They're going to be made by our patients. So it really is a partnership, and that's really what we try to foster. And Sherry is really great at making sure that our patients know what they need to be doing. Like if they're on a specific diet, for example, Sherry makes sure that they know the specifics of their diet and that they feel comfortable with it.
That's amazing, because sometimes people who have renal failure or people who are diabetic get assigned things but don't really understand them, and doctors' visits are so short. So I got to tell you guys this. For those of you out there who aren't familiar with Pinnacle yet, Pinnacle is an insurance-free alternative for quality health care at wholesale cash pay prices. Now, I don't know about you guys, but a lot of people got laid off during the pandemic. All of a sudden, boom, you didn't have any insurance and weren't sure about what your answer with having a doctor would be. And Medicaid, sometimes you really have a hard time with that. So you need to tune in and share this with friends out there. If you're like, oh my God, I need insurance-free, medical care. It's kind of like having a concierge doctor. I feel like this is the sort of thing that the rich people get, or you've got the doctor on call, but you don't have to pay the rich people prices. Yes, y'all.
Well, that
That's
Medicaid
exciting.
extension is going to be running out here shortly. So there's going to be a lot of people without insurance. So this is a great way for people to be able to afford good quality health care.
Mm-hmm. Yeah, and primary care really is, what we do. And we're kind of that front line, hopefully guiding people to high value care as opposed to the very expensive care that may not necessarily be appropriate at the time. So that's really what this membership is for. And then when it comes to the financial tool that insurance really is, people think about that insurance card like it's keeping them healthy, just that little piece of plastic. But really all that is something that represents a financial tool that protects people from a catastrophic financial hit when they don't have insurance.
Sure.
Yeah. So, but our membership gets you to 85-90% of what you're going to need any time that you seek out healthcare. Primary care really is probably the foundation of a solid healthcare system.
That's exciting. Well, I want to hear about you, Dr. Dykert. I just find it exciting that you would really not only set up this service, but be in the position of seeing people every day and taking care of them. I mean, is this something you had as an ambition since you were very young, or, you know, is it something you kind of moved into more as an adult? Tell us all about it.
Well, that's a great question, and it is something that I moved into as an adult.
Okay.
You know, sometimes people will say, oh, ever since they were 4 years old, you know, they had the little Fisher-Price Dr. Kent, and they were going around treating their stuffed animals with it. That was really not my path. All through my school, through high school, and even the first couple of years of undergraduate school, I was planning on being a songwriter, believe it or not.
What?
Yes, exactly.
Wait a second.
Yeah.
Okay, this is going to be a good story.
All right. Yeah, so that's what I was interested in at the time, was basically music and sports. I had taken the science classes that I had been forced to take when I was in school, and I was able to get through them okay.
Okay.
But that's really what I was interested in at the time. But it's funny how things change, isn't it? So when I was a sophomore in undergrad, my family adopted a young boy the day he was, or they were there for his birth.
Yeah.
He was a special needs child from Greeley, Colorado. Needed to have a operation the day after he was born.
Whoa.
In order to correct a defect with his spinal cord. And that is something that you don't know for sure how it's going to turn out. You don't know whether they're not going to be able to walk when they get older, because there's a lot of neurologic problems that can go below that defect.
Oh.
It's a condition called Spina Bifida.
Okay.
So he was born, and very carefully everything was, you know, situated so that he'd be stable for surgery.
Sure.
And this is a very highly specialized, high-level surgery that they were doing, and this is on a one-day-old baby.
Whoa.
And that surgery went well. I'm happy to say that not only is he up and walking around, he's also a really fantastic athlete.
Okay.
He was in high school, and he works construction and is just living his best life. So, but from the day that I saw those doctors in operation, you know, saw them doing what they did and the kind of impact that they could have on somebody's life, somebody that they don't even know, or they just met that day.
Yeah.
That is what really started changing my mindset.
Okay.
And I was like, I want to have that kind of impact when I grow up, you know.
Yeah.
So that's when I decided to shift over and become a biology major and chemistry minor, and then after that, I went on to medical school in Kansas City, and decided to go into family practice, because that's when I was going through my rotations. That is the specialty that seemed to fit what I enjoyed doing the most.
Okay. And this is everyday interactions with people and the questions about the health and
You really-
working to get someone healthy.
It's relationship based, which is the really nice thing about primary care
Sure.
and family medicine. And when I first came out, I was actually delivering babies and the whole 9 yards when I was out in western Kansas, a little town called Colby.
Okay.
So yeah, I was doing C-sections and seeing the newborns, you know, through their well child visits as they were getting older and all that kind of thing. So, and then I was also seeing 100-year-old patients in the nursing home at the same time. So it really was a neat opportunity to be able to kind of see the whole scope of lifetime and be able to care for people of all ages and through whatever kind of issues that they were having. So that was my first gig out of residency.
Okay.
And then moved to Colorado because I was interested in actually this model. And being in the healthcare system for those first, you know, handful of years, you know, 3 years in residency, my residency program actually did a really good job of explaining the business side of medicine.
Okay.
Because, that's what we really want to learn when we're medical students, is how to bill and code properly, right? And learn the, several tens of thousands.
No, y'all, no, that's not what we want to learn, but you learned it anyway.
Well, haven't you ever been impressed by a doctor who could code really well?
No.
All
Yeah.
about
I
the
think
coding.
that I missed that part. I think I'm usually relating, whatever hurts. And these days, I lost my spouse last year. Look, if my pinky hurts, I'd be in the doctor's office like, look, my pinky, can we check everything? Do we need to scan it? Do I have cancer? I ain't playing. I'm trying to live to 100.
Well, good for you. Good for you on that, and I'm sure you'll make it. I can just tell.
Thank you.
Exactly. So yeah, no, that's a really.
But they
important
taught you the
point.
business side.
They did, yeah, and that's a really important point, is that you go to the doctor because your pinky hurts, or you have something that you want to get checked out, and you want to make sure that you're taking hold of your health, right?
Right.
You don't care what they're coding. But
No.
I'm telling you, that is approximately, these poor doctors that are working out in the fee-for-service system right now, 50% of what they think about on a day-to-day basis has to do with that, instead of that patient that's right there in front of them. That's just the way the system's set up. And let me tell you, the administrators, they care a lot more about how well you code than the patients do. So it's just part of the business of healthcare, and that's why this particular model was so promising, and I was so excited to get into it after leaving Kansas.
So you got here, you're getting the practice set up, and you said when we were offline that you just wanted to get back to the doctoring.
I did, yes, and it was immediate. As soon as I switched over to this type of practice, you could notice the change immediately in, first of all, just the way it felt. You went back to enjoying your job. Every single day you were excited to go in instead of dreading, how far behind you were. The paperwork.
Oh.
And I think what doctors really struggle with in the current system is that they don't, I think all of that stuff is secondary. All the busy work is just kind of a symptom of the actual disease, and the actual disease is that we don't feel like we can make that impact. That impact I was telling you
Sure.
about, the whole reason I switched to becoming a doctor was because I wanted to be able to make that same impact that doctor up in Denver had on my brother.
Yeah.
And when you're in that system, you just feel like there's too many roadblocks in your way to be able to make that impact. And immediately after switching to this model where it's a membership-based system instead of fee-for-service,
Yes.
you could feel it. You were there as the patient's combination of things: guidance counselor, advocate, medical professional.
Yes.
And get them up to where they feel comfortable with taking care of their health as a partner with you in the same endeavor.
That is so different than what a lot of people out here are experiencing.
It's 180. It's absolutely night and day. And patients who come into this type of model notice it right away too.
Yeah.
Yeah, it's hard for people to get their mind around the concept of this, because there's, we've had decades of the old way at this point in time.
Right.
But when they come in and they're actually a member in one of these membership type models, it's called direct primary care is the official term, then they hardly ever leave, because the same difference that we feel, they
Yeah.
feel too.
Well, I knew that the first difference was how much time you could spend with people really listening about what's going on.
Absolutely, that would be the secret sauce, I think, is the time. Because there's an old carpentry term, I'm sure you've probably heard this, it's measure twice, cut once, right?
Right.
And you can stave off so many problems in health at the jump if you just have the time to address them. You address that little spark before it turns into a raging forest fire.
Right.
So much more efficient, so much less suffering for the patient, so much less cost to the system. So really doing a bang-up job in primary care, which we have not done in this country for probably 5 decades, 6
Absolutely
decades at this
true.
point in time. And that's really one of the two main issues that is why our healthcare system is so sick,
Right.
is that primary care has really fallen off. And that's why, you know, our life expectancies in this country sadly are going down after they've been going up for years and years and years. They are now decreasing. And I think you can lay that at the feet of the problems just kind of inherent to our system,
Sure.
and then also the fact that primary care has fallen off.
It makes sense to me, even the way that we're talking about when I have conversations with people and they're like, you know, I'm demanding my health care. I'm like, oh, so you want to go to the doctor? No, they're talking about the insurance.
Mm-hmm.
And that just seems crazy. Hi, that insurance card, not health care. The health care is the relationship with the doctor. And now, I heard of a certain provider in town, 10, maybe 15 minutes for an appointment. What? You know, I'm not an expert. I may not even be able to describe to you the right symptom that tells you what's going on in 10 minutes.
It really is a problem. People are complex, and it's not just that are complex, their lives are complex.
Yeah.
And, you know, all of us have been a patient. We all know what it feels like to sit there for an hour and a half and then only get, you know, 7 to 10 minutes to be able to actually address the problem that we came in for. So access is vitally important, and that and the time are probably the two biggest things that make this system, the direct primary care system for primary care, so effective. It's not that we're that better of doctors, although I think we're pretty
Guys are
good.
pretty awesome.
We're pretty decent. April and I. But it's just that we have so many fewer roadblocks in our way when it comes to us and our patients and delivering patient care, that we don't have to jump over all those hurdles like these poor docs out in the fee-for-system
Sure.
do. So that's our whole goal is, I mean, if you look broadly, big term, for what our goals are for this, it's not to make a whole bunch of money or anything like that. It's to make it so that patients have a better primary care experience, and that the people providing that care, your doctors, nurses, MAs, providing that care, love doing that.
Yes.
Because then the care is going to be better. Plus, more of our best medical students are going to want to go into primary care if it's not a miserable job.
Right.
Yes, and it's projected that we're going to have tens of thousands short on our primary care physicians by the year 2032.
Whoa.
Which is a big problem with the aging boomer population. So we need to be able to care for those people in the primary care setting, and because right now, you know, the people that can't have access to primary care are still going into the healthcare system. They're just showing up in the ERs and at the hospitals after their problem has gotten so bad that now it's emergency care at that point in time, or hospital care, inpatient care. So anyway, that's why primary care is so important, and we need to build that back up from the ground up with our best medical students, and then that right there would have such an impact on the healthcare system that we couldn't even believe this. There's no well-functioning healthcare system in the world that doesn't have a solid foundation in primary care.
Absolutely.
But I think we could do even better. I don't think we should be like, well, I think we could be as good as those other countries that do that. I think if we implemented this type of primary care system, we could have the best healthcare system in the world, and it wouldn't even be particularly close.
Yes, I love that. Guys, Dr. John Dygert, this is my kind of doctor. I'd like to take a commercial break here at Rachel's Roundtable. Family Flavors Aside, World Broadcast Network. If you've become intrigued with the subject matter, feel free to call us at 719-300-7936. You've tuned into Rachel's Roundtable right here at Family Flavors The Slide, World Broadcasting Network. And I'm so excited to be talking today with Pinnacle Advanced Primary Care. I've got special guest Dr. John Dygert, and I've got Sherry Brown here. And we are talking about just literally, you know, an answer to a problem that so many have had in the community, and, you know, to a certain extent may begin to have in the community as some of the things, you know, happening with people switching back and forth with jobs and other things happens, no matter what, you can go to Pinnacle Advanced Primary Care and you can get excellent care because it doesn't run on the current fee-driven model. Yes, y'all. It's not fee-driven? Tell me more.
Yeah, just think about it like a Netflix subscription to a primary care facility. So that way, so people who come into our clinic, there's no copay for seeing the doctor.
Hold up! No copay! Listen, y'all better share this with your friends. You know they want no copay too.
Because the copay really is put in there by the insurance companies to dissuade people from going to the doctor as frequently as that. Yeah, that's what that's there for, actually. So what we want to do is eliminate any kind of barrier between you and access to your doctor, because that's really important.
Right.
And some people are like, well, then people are going to be calling you all the time. They're going to.
So what?
Exactly. I mean, but that's not actually what happens. What happens is that people may call a lot at first. But once they start feeling comfortable with their care, they get to what we call cruising altitude, and then they're doing just fine, and they just call you when they need you. So there are people that are very anxious with their health in the current system that we can make feel a lot more confident in their ability to manage their chronic illness or their acute illnesses or the preventive strategies. When they come in, we get a plan for all of that stuff, and they are working with us in order to make all that happen.
Yeah.
And it's catered to their individual needs, because not every person is the same.
Right.
And when they do that, they feel really a lot more confident. It's called health confidence. Are you familiar with that term?
No.
They've actually done studies on this.
Okay.
John Lawson and Eric Coleman, who's actually a doctor up in Denver, did a study on health confidence, which is actually just patients' own subjective scoring. They used a 1 to 5 system, with 1 being the least confident and 5 being the most confident. And they looked at what would happen if they got people's health confidence scores up.
Yeah.
And guess what happened?
Their health got better.
Their health got better, outcomes were better,
Yes.
cost to the system was lower, individual cost was lower, and they were much more satisfied with their care. So it's a big deal. Actually, Health Affairs wrote it was the front page of their magazine, calling it, this is in 2014, they called health confidence or patient engagement the next miracle drug in healthcare.
Wow.
Because that really did achieve the quadruple aim, the IHI's quadruple aim. Are you familiar with that at all?
No.
Which is just, it's outcomes, and then cost to the system,
Yes.
provider satisfaction, so doctors, nurses, MAs, etc. And then, let's see, what was the last one? Satisfaction with individual satisfaction with their care.
That's just amazing.
Mm-hmm.
And what's really crazy is that this is the conversation you very rarely have. I talk to people all the time with being a community advocate, and they are anything but satisfied with the health care. They can't get in to see someone. They can't get someone to listen. They can't sometimes get to, the pharmaceuticals that they might need. And then, of course, we have some people that they don't want pharmaceuticals. They want something else. They don't feel like they have choices. But this model of primary care that you guys have raised up brings all of that.
It really eliminates access barriers. It really does. And it's so affordable. I mean, it's $70. I spend more on my mani-pedi.
Girl.
We spend $70 on an oil change. We take better care of our cars than we do our health because of the access and the co-pays and the surprise bills.
And wait a second, that's the adult price.
That's the adult price.
The children under 18 monthly cost $28? What? Amazing. So for some people sweating it, our insurance, this was at my house. My husband was a kidney patient. Our insurance, $750 a payday.
Mm-hmm. And that was
They
just
didn't
their
count the
portion.
co-pays, didn't count the pharmaceutical stuff. It was just absolutely enormous. And kind of the struggle of life for years
Mhm.
with making sure, I mean, that's a house payment,
Oh my goodness. It's
right?
the inflation rate for the healthcare system has so vastly outpaced the inflation rate for the rest of the economy over the last 30 years. And this is no joke, that it's solely the healthcare system that you could say is responsible for stealing 30 years of wage gains for the working class and the middle class.
Right,
Because
sure.
all of that money is going to healthcare, because you just said it. Your premiums are higher, your co-pays are higher, your deductibles are higher.
Absolutely.
And then once you get done paying your in-network deductible, you're still responsible for paying your out-of-network deductible, which is twice as much. You just
Absolutely.
start over again from scratch.
But we could kick it all to the curb and come to Pinnacle.
You
I
could.
love it.
You could kick, yes, and use this for your primary care, and then there are other options that we can use for that financial tool that we were talking
Sure.
about, instead of the the day-to-day insurance system through employers, and then employers can actually take steps to fix their own plans. That's the really exciting thing. Schools have done this, municipalities have done this. Have you heard about that at all?
No!
Oh, okay. I got to tell you about Pittsburgh school
Okay,
system.
okay.
So first of all, they implemented this type of primary care, this type of easy access, free to them, high quality primary care, because they know that that's going to save downstream
Right.
costs. So that's one of the main primary things that they did, was implement this system. But then they also went back in and they looked at their contracts that they make for their insurance plan, because there's vendor agreements,
Sure.
which is like who processes your claims, there's provider agreements, there's like how much would we pay for this hospitalization or this surgery or that kind of thing. And then there are agreements that, for the business owner, that rule how you deal with the money that comes into the healthcare plan, which is basically ruled like a trust. So there's a fiduciary duty there.
Okay.
So what they do is they rewrite those contracts so that you can't get gouged by the system.
Yeah.
And that's kind of the foundation for everything. And then they replace bad insurance plans with much, much better ones. They get rid of kind of these pharmacy middlemen that take, billions of dollars out of the system every single year.
Whoa.
So Pittsburgh was smart about what they did.
Yeah.
All of their teachers and every employee that they had still got just as good of benefits, except they were much better because they had this type of primary care.
Exactly, where they could go in as often as they wanted, or they could do a telehealth appointment from the house, or they could, begin to
Mhm.
create plans for their wellness.
Text, email, all of that access is available to them, just like it is with us. Just like it is with us.
Yeah.
On the weekends and at night as well. You're texting your provider, not a nurse who doesn't know you from Adam. You're texting your provider.
That'd be amazing. I could do that while out of town on a trip, couldn't I?
Oh, absolutely. We've had that happen. I've actually got patients from Texas and Kansas that see me when they're in town, but also virtually. Yeah.
Okay.
So yeah, there are people that recognize the value, even not necessarily in the close proximal area.
Okay.
That impact that I was just talking about with that school system.
Yes.
You want to hear about that?
Yes.
They saved enough money to that. So if you were a brand new kindergartner going into the school system, for the course of your K through 12 in the Pittsburgh school system, they saved the equivalent of $2 billion that would be accessible by all of the resources providing the education to these students K through 12 years. So that's higher teacher salaries
Yes.
with better benefits.
What?
Yeah, exactly.
Where you at, Colorado Way? Woo! Okay.
Some schools have done this in Colorado.
Y'all better come on. Where you at, D2? Where you at, D11?
This is a very, very effective system fix for schools. Schools, municipalities do really well with this because they have a pretty low turnover in their business rates, and they can save 20 to 40% saving compared to paying more and more every year.
Where y'all at, El Paso County? I'm just saying, this sounds better than some of these current things. And, you have the insurance for your catastrophic portion, which hopefully you don't get to. Do you know what I mean?
Mhm.
But you could do that differently if your primary care is taken care of.
Absolutely, and you're going to need that a lot less often if your primary care is right, because primary care would be the first person you go to.
Right.
If you're stuck on a Friday night, it's 10 p.m. and you've got belly pain and you don't know whether you need to go to the emergency room because it might be an appendix or not, if you can call your primary care doctor first, they can guide you, you know?
Yeah.
So, I mean, because sometimes it would save an inappropriate emergency room visit.
Right.
But if it was something that needed to go to the emergency room, you could have the confidence that knowing that your primary care said, no, this is definitely worth going into the emergency room for. Advocate for the patient and access, so crucial. So, and then that happens, you know, we'll get a call, you know, middle of the night sometimes, and, you know, it's just a question, be like, I don't know whether I need to go to the emergency room for this, or if this is something I can follow up with you afterwards.
Mm-hmm.
And sometimes it is, sometimes it isn't. And you want people to be able to have access to emergency services when they need it, but you also want to avoid all of the inappropriate emergency room visits and hospitalizations as much as you can.
Sure do, because those copays are no fun, y'all.
Well, that, and plus it's just, I mean, the more people that contribute to the cost of the system, the more it's going to cost year to year. So if you can head that up with a pass, if you had that solid primary care foundation, that's going to save so many downstream costs that eventually our premiums start going down.
And bankruptcy due to health care bills is what, number 2 and
Yes.
number 2 reason in the
No, it's
nation,
number
right?
one reason.
It's number 1 now.
2/3 out of every bankruptcy is because of healthcare bills, and 60% of those people have insurance.
Whoa!
Yeah, that's a broken system right there.
Really broken.
60% of medical bankruptcies are people who have insurance, which was mind-boggling to me. I did not think that was an actual stat, but it is.
That is amazing. I was really kind of excited thinking about this in that context of the money that's saved, of the access that's gained, and I'm like, are we doing more in Colorado legislatively, do you think, that will support models like this?
That is such a great and timely question, Rachel.
Well,
So-
I've had some interaction with some entities politically, and I've realized there's some shenanigans happening. So.
There's some shenanigans, but they're kind of putting an end to it up there, which is
Okay.
really great to see. How often do you see a bill go through hundreds of dollars for COBRA instead if you're between jobs?
Hello.
But, yeah.
Oh my God. Please don't talk to me about that.
Sorry, I brought up a sore subject there.
The hood was out, they had the fangs, they were spitting the venom.
Yes.
Oh my God.
And that venom goes far.
Far. It was just really wild.
It is.
The offer to us, oh, you can join us for $3,000 a month.
Uh-huh.
It was twice as much
Uh-huh.
as we'd been paying for insurance.
And that would pay for, what, 2 years of Pinnacle?
Yes. Yes.
3 years, yeah. Yes, so it's a good solution. It really is. Patients are happy with it. The providers are happy with it. It's so much more honest and upfront. Because here's the thing, like, I mean, it's not like we're having you sign a year-long contract.
Right.
If you join as a member and you decide that it's not working out for you, which I don't know, I guess
I don't
maybe
think
that'll
Bill
happen
has done
sometime.
that.
Maybe sometime 20
I think
years
most
from now.
people, you get them and they're like, woo!
But if they did,
Dancing a jig.
they could just leave, you know, and then that's
Right.
on us for not providing what they needed. But most people, you know, first of all, we kind of like most people, so we enjoy their company and we want them to be healthy, and we do what we can to help them with their decisions.
And you give them a real appointment time.
Exactly, and
With having some time.
30 minutes to an hour.
30 minutes to an hour,
Yes.
and unlimited.
Yes.
And then you also have access to us for virtual visits. We can do Zoom. If it's just a question you want answered sometime in the next day or two, just send us an email. All of it's secure. If it's something that you need an answer pretty quickly, we've got text services that are available.
Wow.
We want access to be there so that we can be there for our patients.
And I love my providers because this is such a new concept that people have a hard time wrapping their head around it.
Yeah.
So if you're not sure if you want to join, you can call me. I can set you up with a tour. We can do a 15-minute meet and greet with the provider. So you're doing a 15-minute meet and greet. This is the same
You can't even get
as your-
15 minutes with the regular doctor.
Exactly.
And you know, not that you guys are irregular, but I'm just saying.
Right.
The copay fee driven system They give you less and less time now.
It's about what, average 6-7 minutes. By the time that the medical assistant gets done doing their thing, you're left with about 6 or 7 minutes with
That's
the
true.
doctor.
Because they take your vitals, they sit you in the office with nobody in it. You sit there wondering when somebody's gonna come.
And I'm a little chatty, so my medical assistant, when I'm rooming, you might have 6 minutes with the doctor. So,
This is so amazing. Why don't you give out the contact information one more time?
Of course.
And we'll just.
And thanks for the opportunity again. Yeah.
I was delighted to have you. I'm trying to remember. I think I literally found you guys on like LinkedIn or something by accident.
we met at the Colorado Springs Black Business Chamber 30-year anniversary.
Oh, that's right.
Yes.
Yes. Y'all know. Those are my peeps. So I actually am one of the founders of the organization. It was a melding of two organizations. The Colorado Springs Chamber has been around for 30 years, but they recently consolidated with Colorado Springs Black Business Network. And for a long time, the public knows this, there wasn't a lot of activity with the Black Chamber. So we started the business network and started doing all these events and hyping up the energy and getting people to connect to one another. So they melded. And it is so fantastic to see that they have the structure and the solid nature and the teaching of the chamber, and now they have the vibrancy and the excitement of
Super
the
excited.
event.
It was a huge turnout. I was very excited.
Exactly.
Yeah.
Exactly, and totally connect with them. I mean, you would have so many people that would be rah-rah about Pinnacle. Okay, so back to the contact information.
Oh, yes. So our address is 218 East China Mountain Boulevard, down in southwest Colorado Springs, right next to the Hatch Cover in Country Club Corners. And then our phone number is 719-465-1579. Our website is pinnacleapc.com for advanced primary care, pinnacleapc.com.
And for those of you who live southeast, this isn't far. This is just a shot across Circle, and you would just jump up onto where you'd go on 115 to the Fort Carson gate. Come on, y'all, that's not even 15 minutes. Listen, you'll spend more time driving to Pinnacle than you would get with your current doctor. Yeah, I'm clowning. I'm going to keep on clowning about it too. I sure am. We are so glad to have you. And I'm so glad that we were able to discuss this. It's just not every day you see a real market solution to problems that people have that actually builds more equality and access and takes away barriers. I love it. I mean, you guys,
We appreciate you having us
Yeah,
on.
thank you very
it was
much.
delightful to have you on. All right, so that is it for today's roundtable. I believe that next week we're going to be chatting with some of the folks from Silver Key, talk about kind of what's happening with the seniors in the area. So it's time to go. Thank you for tuning in to Rachel's Roundtable right here at Family Flavors of Slide, World Broadcasting Network. See you next week, Monday morning at 10:30 a.m.